Now, we look at the tachyarrhythmias due to the impulse conduction disorders. The first example of this group is atrial flutter. This is an example of atrial flutter. It originates from the right and left atrium. It's due to re-entry. Usually, its rate is 250 to 350 beats per minute. For the P wave, this rate refers to the P wave. And it's a rapid, regular P. The typical sawtooth appearance, here the sawtooth appearance, so-called, the other name is a Flutter waves. And the treatment of choice is drugs or cardioversion. There are many classifications of atrial flutter. It's type 1 and type 2. Type 1 is an organized that is a sawtooth appearance. Like here, you see the typical sawtooth appearance. And type 2 is a disorganized and appears as atrial fibrillation and atrial flutter, so-called a fib flutter. And the P wave is usually best observed in lead 2, 3, and AVF, and in lead 1 sometimes. So here you can see a typical sawtooth appearance. The ventricular rate in atrial flutters varies. It depends on the number of flutter waves conducted through the AV node to ventricles. That is, if there is a 2-to-1 AV block and atrial rate is 300 beats per minute, then the corresponding ventricular rate will be 150 beats per minute. Here are the examples of atrial flutter with different degree of block. So here's the atrial flutter rate, 250 beats per minute, with every other flutter wave conducted to the ventricle. So for 2 flutter waves, one is conducted to the ventricle and the other is non-conducted. So the atrial flutter rate is 250 and the ventricular rate is only 125. Here is atrial flutter with 4-to-1 conduction. That is, every 4th flutter wave is conducted to the ventricle. So you have a 4-to-1 conduction. So this flutter wave, this and this is not conducted, and the 4th one is conducted into the ventricle. Sometimes the atrial flutter will appear with variable AV block, resulting in irregular ventricular rhythm. As shown here, it's 4-to-1, maybe here's a 3-to-1, so different degree of block will appear in different time. Sometimes, if you do a carotid sinus massage, you can review the flutter wave in more details. Shown here, if you do the carotid massage, actually the ventricular wave will be slower and slower because it increases the block in the AV node. So reviewing more clearly the flutter wave.